This is Denise. She's our high fidelity simulated patient. Hello, Denise. She talks and blinks. So all patients who undergo an anaesthetic have to have monitoring. So we put an ECG on to keep an eye on their heart rate and heart rhythm. Blood pressure cuff here, keep an eye on their blood pressure. A little clip on their finger measures the oxygen. And we also have to have venous access. So we put a little drip in. Come around. Come and have a look. So we put a little drip in here, and through this we can administer the medicines. So when we give somebody anaesthetic, we put them to sleep by putting the induction agent or the anaesthetic through the drip. And once that goes in, it takes about 5 to 10 seconds to work, and they'll fall asleep. And we keep them asleep by administering the anaesthetic gas. So as long as the gas is running, the patient will remain anaesthetised. Alright, so we're going to start off. Denise, I'm going to give you some oxygen, is that alright? Okay, there we go. So I want you to take some nice big deep breaths for me. Turn the oxygen on. And you'll see that Denise here is breathing by her own. Alright, so once we're happy that Denise is ready to go to sleep, we're going to give you the anaesthetic agent. Alright, so that's in now. So in about 5 to 10 seconds, Denise, you'll start feeling very sleepy, alright? And we can see that Denise's eyes are falling asleep. Denise, are you awake? Alright, so Denise is anaesthetised. We need to make sure that she can breathe, so I'm going to give her a few breaths on the bag, and we'll see that her chest is moving here. And there we go. So now we need to ensure that Denise continues to breathe for the rest of the operation, and I don't have to stand here and hold this bag for the whole case. So I'm going to put a breathing tube in, and to do that we use a little device called a laryngoscope. Put that in her mouth there. And doing this allows me to see right into her mouth, right into the top of her windpipe. So I'm going to put this breathing tube into her windpipe here. It's called an endotracheal tube. Take that out, and we're going to check that we're in the right place. So I'm going to give her a few breaths here. And you'll see that her chest is moving now with me squeezing the bag. Okay, and I'm going to transfer her over to the ventilator. And now the ventilator, you can see the bellows going up and down, that's going to do the breathing for her for the rest of the operation. So Jen's just going to secure the tube here. So once we're happy with all that, we can tell the surgeons they can start operating. So the surgeons would now cut open your belly or fix your leg or whatever the operation is that you're having. And during the operation, we keep an eye on your recordings, keep an eye on your heart rate, your blood pressure, your oxygen levels, your breathing ability. If any of those things cause us any problems, we have a whole series of drugs here that can help us. Drugs that increase your heart rate, decrease your heart rate, increase your blood pressure, decrease your blood pressure, help us deal with allergic reactions. Anything that could happen to you under an anaesthetic, we have the ability to deal with that. We've got some antibiotics here, various types of pain relievers, various types of anti-nausea medications, various types of muscle relaxants. So once the operation's over, we then turn the anaesthetic gases off. And once we've turned the gases off, it takes about 5 or 10 minutes for the patient to wake up. So we take all the protective equipment off and start waiting for Denise to start opening her eyes. So she's opening her eyes now. So Denise, your operation's all over. I'm going to take the breathing tube out. Cuff down, please. Alright, okay, here we go, Denise. May get a little bit of a cough. There we go. Chuck that on the rubbish. Check that up, check there that she's still breathing. You okay, Denise? Are you comfortable? Right, very good. Alright, and once we're happy that she's awake enough and that she's able to breathe for herself and look after herself, we'll then transfer her to the ward bed and take her through the recovery room.